Hello and welcome. We are going to go ahead and get started with our session today. So welcome to the webinar From Crisis to Collaboration, Michigan's Journey Towards Water Justice. My name is Ellen Kohler. I'm the Director of Applied Research and Programs at the Water Center at Penn. We're really happy to have you with us today. And I will be the moderator for today's session. And I have a personal interest in the topic today. I lived in Michigan for 15 years. I still own a home there, and I am a municipal water bill ratepayer. So very interested in the topic myself. Emma, if you don't mind going to the next slide, please. For those of you not familiar with the Water Center, we are an applied research center based at the University of Pennsylvania. We have an interdisciplinary staff of 7 that is supported by senior advisors, graduate student research fellows, and faculty colleagues across campus. We partner with communities to identify integrated solutions to the challenges that they are facing with their water systems and their watersheds. And our work falls into these 4 focus areas on this slide. Next slide. Off campus, we partner with many water organizations working on water challenges. We have been working with the Mayor's Innovation Project for more than 6 years, since pretty much the inception of the Water Center. Mayor's Innovation Project is based at the University of Wisconsin at Madison. And we've been working with them on things like community of practice events, one-on-one technical assistance, mentor-mentee programs for water utilities. And that work has included topics like water affordability, drinking water systems impacted by PFAS, and water leadership. Next slide. And for the purposes of our webinar today, we partnered with the Mayor's Innovation Project to convene a Water Affordability Academy, and then supported 4 communities who participated in that academy. We supported them in developing a water affordability program. Oakland County, Michigan was one of those 4 communities. And we developed case studies about that work for each one of those communities, and Emma will be sharing those case studies in the chat. This work started in 2021, before my time at the Water Center at Penn, and it was led by Erica DePalma, who is now a program manager at the U.S. Water Alliance. The Oakland County Water Resources Commission sought assistance because it was one of the communities facing the systemic issue we see of having a big backlog of needed water upgrades and repairs while being ill-equipped financially to address that need, and serving a population who can't afford large rate increases. I want to make really clear, this is an issue that we see with water systems of all sizes, not just in urban areas. Mayor's Innovation Project, the Water Center, and other partners supported the commission through a multi-step planning process that led to the development and adoption of a water affordability program. So with that very broad framing, I'd like to turn to our speakers today to learn more about what's happening in Michigan now. Next slide, please. So I'd like to welcome our speakers. We have with us today Sylvia Orduño, the Executive Director of People's Water Board Coalition, Sara Rubino, the Government Policy Attorney for the Oakland County Water Resources Commissioner, Senator Stephanie Chang, member of the Michigan State Senate, and Cyndi Roper, the Senior Policy Advocate for the Natural Resources Defense Council. Each one of our speakers will make some comments, and then we will have time for questions and answers at the end. And so please use the features in the webinar to share your questions with us during while people are speaking, but we won't get to them until the end of the session. So with that, I'm going to turn it over to Sylvia. Thank you.
Thanks very much for the kind introduction there, Ellen, I know I'm delighted to be here. This is work that many of us have been doing for a long time, not just in Michigan, but nationally. And so this is really a terrific opportunity to talk about what's going on. But I'm hoping that when we get to some of the questions, we'll hear more about a lot of the terrific engagement that's happening on this issue in other places. So let me start by beginning to say that, yes, I am serving as the executive director of the People's Water Board Coalition. We've got over 36 members from grassroots organizations, faith-based organizations, environmental groups, and other supporters that have been doing this work for a long time with us. But I come to this work fundamentally as a community organizer, where I started this work in 1997, working with the Michigan Welfare Rights Organization. And folks will remember that this was just a year after welfare reform in the United States. And we saw a lot of things happening through TANF that in part changed the ways in which a lot of low-income people were going to be responsible for water bills if they were receiving public assistance, and the ways in which formulas were calculated for how much a household would be required to pay. So for me, that was kind of like the basis of kind of starting to see changes that were happening with a lot of households. And so in the context of that work too, we very much were doing it from a point of view that poor people have rights. And while low-income households may not always be able to afford what it is they need to pay for the basics of life, anywhere from water to energy to housing, food, and on, it doesn't mean that anyone should ever be denied these because they can't afford to pay. So it really also formed the basis for how it is that we approach this work to say, look, we've got to ensure that the least among us are never denied what they need. And the water fight with local governments actually took a turn for something pretty surprising, and I don't think we expected, especially when we think about how local governments are really supposed to be working for the residents themselves and know that a lot of the challenges that it takes when you've got people of different means. But it also was a big learning lesson at the beginning about how this was not going to be an easy process to go through. So I'm going to ask you if you can please switch the slide there, please. So again, you'll see the mission of People's Water Board there, where we've really done a lot of focus specifically on how impacted households are affected in this and how we're pushing for human rights to address these problems as well. Next slide, please. So here, it's really just a short timeline of a lot of the work that we've been doing over the years. And I'm going to just hit at a few of them that I think are pretty critical to how we got started on this. And so while a lot of our work has really had a Detroit focus, it's really about the city of Highland Park, where this little community, actually there's two little communities inside of the boundaries of Detroit where this work got started. And folks might remember Highland Park as being a place where the Model T factory was built in and operating for Henry Ford and Ford Motor Company for many years. And it actually taught us a lot of things there at the beginning when you've got a little town where big companies have left and the tax base changes and you've got older population of people that have remained and they bought homes and they raised their families and the families left. But you've got a smaller group of people that are now responsible for a lot of the water bills that the local government relies on, but it also has a really old infrastructure. So that was really like the grounding for how this work got started. But it also was shortly afterward when we started hearing more about the problems with fiscal solvency, or what was being called potential bankruptcy in a lot of our local communities. Detroit and Highland Park were among those. And it wasn't even just the city governments themselves, it was also many school districts. So there was a lot going on across the state where the governor and the state was trying to figure out what are we going to do about all of these communities that can't afford to basically pay for all of what it takes to operate a municipal system. On the water issues in particular, there were a lot of needs for repairs, operations, maintenance, obviously, but a lot of residents that couldn't afford to pay the bills that they were getting sent, and a lot of concerns about what does it mean when this debt is accumulating? What do we do when residents can't pay, want to pay, but can't afford to pay? And when it starts actually affecting the ways in which the water utility can actually operate. There's lots of other things here that we can always cover at some other point, but I want to highlight just a couple more things here. Is that as we were doing this work over the years, one of the things that we found that was pretty critical was that we really had to figure out how to have engagement with local government. And it seems pretty typical, right? Because whenever anyone is told, if you've got a problem with the government, then you go visit your elected leader, you make phone calls, you write letters, you attend a meeting. And we did all those things, right, of civic engagement that we're taught that this is how you make change, this is how you have your voice heard. But it really didn't have much impact when we were having residents go and testify and tell their stories, and we're collecting more information from people, we're visiting homes. But the problem wasn't just about a handful of people or even dozens of people. We're talking about thousands of residents that were in similar situations with not being able to afford their bills, and in various stages of like response by what the local government was doing. Some people were getting multiple shut-off notices. Some folks had had their water shut off and were living for not just days or weeks, but like months and years without water. And so we saw really dire circumstances and saw like really big problems, not just with the water not coming out of the pipes itself, but also basements that were backing up with raw sewage. So the whole of the water provider problem that a lot of residents were having. It wasn't until we actually started working with local attorneys, Michigan Legal Services and the Michigan Poverty Law Program at the University of Michigan in particular, where we started saying, look, we've been doing this advocacy with the local government, but we need to start looking at what are some of the legal options or things that we need to be paying more attention to, because clearly we were finding problems with also consumer protections or the lack of due process in a lot of the work that was happening. And so it was in the context of that work where we were also put in touch with Roger Colton, who many of you, I'm sure, also know now, who is an economist and had been doing a lot of work in the utility sector, the energy sector. So let's go ahead and fast forward on that, please. Thank you. So the basis of our advocacy has really been around engaging the public and educating them about the water affordability problem that a lot of low-income residents were having, and trying to figure out what is it that we need to do to actually build more awareness, more attention for the problems. In the course of all that, we saw that, there's some policy problems in the ways that we were seeing how the water department in Detroit and Highland Park in particular were carrying out shutoffs, not really believing that there was enough being done to protect residents from going without water, knowing that there was serious harm also involved with that. For folks that are aware, and maybe this is happening in other states, but Michigan is one of those states where if a household does not have running water service, the home is considered uninhabitable. And so we had a lot of parents that were kind of flying under the radar and not having, really not bringing attention to what was going on in their homes. Certainly didn't want teachers knowing, didn't want any caseworker knowing if they had a Department of Health and Human Services case to help them with other kind of benefit needs. And so what we ended up finding was there are a lot of people that were living without water quietly. Sometimes they might get some help from a neighbor. Maybe like we saw water hoses going through kitchen windows. We saw people that were just relying on relatives to come and bring water from the grocery store or filling up tubs at their homes. Really kind of dire circumstances. But what was really worrisome for us was a lot of the health problems that we saw households experiencing. And so we saw that this was actually going to have to take a more urgent situation for us to address. So let's go ahead and change the slide there, please. So one of the things we did participate in was a study that the University of Michigan did, that was 3 years ago now, where they were actually starting to pay more attention to a lot of campuses were looking at the water affordability problem, but University of Michigan in particular said, look, we believe that there's more that we can do to help really analyze what is the state of the problem for water affordability, because the problem had really just been believed that this is a Detroit, Hamtramck, Highland Park, Southeast Michigan problem. It really wasn't a statewide issue. And so some of the rhetoric that we heard from folks was, you all just need to pay your bills, you need to just be responsible for your debts, and you need to just get your act together and stop asking other people in the rest of the state to bail you out. And so for one, it was not helpful, but it was also a lot of blaming and shaming narratives that were really frustrating the work that we were trying to do and the education and awareness we were trying to bring to the problem. And so that report in itself was really helpful as well. Let's go on to the next slide, please. I know we're running out of time here. So I just want to point out here that I know a lot of folks have been in the conversations around the difference between affordability and assistance. And that's something that we really had to push hard for in our conversations with local leaders and water providers, because it really had been a belief that if they just offer something, whatever it is that they felt that they could do, that water providers could help the customers that are in need. We kept having to make the case that no, the water affordability problem is a long-term chronic issue that is going to have to be addressed in a different way. And so we've got some of the parameters around that there. Next, please. And so for us, it was really about asking providers to look more closely at how it is that they're operating and managing their finances and designing their programs and rates, designing their rate systems, and pushing to actually have them take on the matter of water affordability as part of their operations. Next slide, please. And so the years of our work has really been around this public education, but frankly, it's taken a form of social protest as well, as we've had to also really build strong awareness and to show that the concerns here that we were raising were serious. Next slide, please. And then these are just a couple of slides with some screenshots of what some of the early state legislation looked like back in 2015, as well as the first water affordability ordinance that we had here in the nation that Roger Coulter had done for us in Detroit in 2005, but unfortunately never got implemented. Next, please. And then again, this has been some of our work over the years as we've tried to build support through the legislature, where every March we go out to the state capitol and participate in World Water Day activities. Next, please. And then just lastly, because some of the work has been so difficult over the years, we realized that we had to take more legal initiatives in order to build support and counter what some of the problems have been. I mentioned earlier that some of those have been consumer protections, but also some due process civil rights violations and disparate impacts that we also needed to raise, especially where there were majority communities of people of color. So I'm going to end it there because I know there's a lot of good information to come in some of our other presentations, and so I appreciate this time. Thank you.
Great, thank you very much. Sara, go ahead.
Hi, good afternoon, everyone. My name is Sara Rubino, and I'm an attorney with the Oakland County Water Resources Commissioner. For those of you that might not know, I can hold up my hand and show you where Oakland County is here, but we're in Southeast Michigan in the Metro Detroit area. We are the second most populous county in the state, and we have a population of about 1.2 million. So we're just behind Wayne County in terms of population size. And Oakland County is made up of 62 different municipalities. We're mostly suburban, but we also have some semi-rural areas. One of the things I wanted to mention also is that Oakland County is one of the wealthiest counties in Michigan. And I say that because it's important to remember that even though we are considered by some measures to be a wealthy county, water affordability is an issue. So it's an issue everywhere. If you can advance to the next slide, please. So what does the Water Resources Commissioner do? I know this might be unique. I know we've got a lot of people joining from across the country. So the Water Resources Commissioner, it's an elected position. It's currently held by Jim Nash. Traditionally, we were a drain office. So we're responsible for developing, planning, and maintaining drainage systems across the county. So that's about 429 storm drains that we manage. Over the course of the county's history, the Drain Commissioner has taken on additional duties and eventually was changed to a Water Resources Commissioner. So we also serve as a designated county agent. So we operate and maintain many water and sewer systems for communities throughout the county. So that includes 10 regional sewer systems, 26 local sewer systems, and then we also operate and maintain 22 local water systems. So for those water systems, except for one that we own, those water systems are owned by the municipalities, and then by a contract, we will operate and maintain them. So the Great Lakes Water Authority is the regional wholesale provider for those water systems. But in addition to operating and managing, so taking care of the actual infrastructure, we also provide billing and customer services to those communities. So that's how we got involved in this conversation. So again, in our role working with different communities, we will help them set budgets. So what does your system need? And then based on those budgets, we help provide suggested rates. but those rates are not decided by our office. Those have to be voted on by elected officials and councils and boards. And I want to bring that up just to mention that, one of the things I learned early on is that, setting rates is more of an art than a science. And so we know what a system needs to be to operate and be maintained, but it's not always reflected in the rates. Next slide, please. So we did not create this slide. I do have my source cited there. I think it's amazing, and I don't want to take credit for it. But as a water utility, we really have three primary objectives. So the first is to provide reliable service and quality water. And the way that this is done is by investing in the infrastructure to make sure that we can provide those services and deliver that water. But we also have an objective to maintain fiscal viability. We have to stay solvent, and we have to have the ability to pay for our capital needs and our operation and management and our existing and our future financing obligations. So we also have to do this and provide these services at a cost that's affordable to our customers, residential and non-residential customers. So this trilemma occurs when there's insufficient revenues to pursue all of these goals. And so there's always a balancing factor among these competing obligations. So if we're prioritizing affordability, then that might cause an issue that the revenue is not going to sustain our capital expenditures and our existing debt obligations. Alternatively, if we are focused mostly on fiscal stability and investing in infrastructure, then the rates that we need to charge might become unaffordable. So again, these competing interests are balanced differently in each community. So as I mentioned, we serve 22 systems, and these are not, they each set their own rates. And so this results in inequities amongst communities, where some communities can afford to set higher rates and other communities might not be able to. So in 2020, when the COVID-19 pandemic hit, there was really a spotlight shown on these inequities among the communities. And the need to have access to affordable water services to protect public health really became very apparent for a lot of municipalities. With the leadership of Senator Chang, there was a ban on water shutoffs when the pandemic started. Commissioner Nash stopped the practice even before the state ordered it to do so. We understood the need and wanted to make sure that our customers could have access to water services. If you can advance to the next slide, please. So part of this, or, around the same time as the pandemic, our office had been doing work again with the Mayor's Innovation Project. And so we had been starting a dialogue around water affordability. We were also fortunate enough to receive a grant from the state of Michigan. So from the Department of Environment, Energy, and Great Lakes, we received about $500,000 for an affordability and planning grant. The grant was provided to research affordability programs across the state and to develop a plan for 2 of our communities that could become scalable for other communities to use as well across the state. Next slide, please. So the 2 cities that we focused on in our grant work was the city of Pontiac and then the charter township of Royal Oak. So these are 2 municipalities. As you can see, they are extremely different in terms of size. The city of Pontiac has a population of just over 60,000 people. The charter township of Royal Oak has just over 2,000. So we have, again, very different looking communities, but both of these communities are considered significantly overburdened communities under the state's criteria for state revolving loan funding. So these communities, again, they both had the most extreme water affordability issues out of the communities that we served and provided water services for. So these were the communities that, again, we looked at developing a water affordability plan but we wanted to do so in a manner that other people could utilize it to implement similar plans in their communities. Next slide, please. So there were many discussions internally and externally about what the goals of our plan would be. I want to say a special thank you to People's Water Board Coalition for their work in this. They were very instrumental in helping us evaluate this. We worked with a stakeholder group that included communities, customers, advocates to help discuss what the goals should be for this plan. Even internally, this was something that there was a lot of discussion to set what our top priorities were going to be. And so first and foremost was to stop shutoffs. So I can't express enough from a utility perspective, we never want to shut off water services. And so that was a practice. Well, there was a moratorium in place, even when it expired. At the state level, we decided that we would not resume shutoff. So we continued that moratorium, and we wanted to have a plan in place to be able to move forward from there. So another goal is to improve the level of service we provided to all water customers without creating additional burdens for our customers. Another focus was water security. And what we mean by that is that we wanted to have households feel secure in the services that they would receive reliable water services. We wanted to make sure that funding that was available to help households was reaching those households. We also wanted to protect the utility stability and financially finding a sustainable funding source to make sure that that we could continue to invest in our systems. And finally, we wanted to establish authentic, engaged, and active partnerships. I think we realized very early on in our work, particularly in this grant work, how the level of distrust that there was with our office. And once we started engaging and having some very frank and sometimes difficult conversations, I think we realized that, we needed to rely on community partners to be able to repair a lot of those relationships and start to, accomplish the goal that we wanted together, which was to deliver affordable water services. Next slide, please. So our grant research started out with a literature review. And for any of the academics who are on this webinar, thank you, thank you, thank you. There's so much research out there. It's almost overwhelming. But it was also incredibly helpful for us to get a pulse of what was going on, not only in our state, but across the country. From that literature review, we were able to read a lot of case studies, and we were able to learn from different communities, what they were struggling with and what solutions did they start to work towards. What was just amazing to me was how receptive other communities were when we contacted them. So we would call up, and it would just be a cold call and say, hey, we, learned about, read about your program. Can you tell us a little bit more about it? I mean, and we met with different utilities and communities, from California to New York and, all in between. So the Mayor's Innovation Project also helped connect us with a lot of folks, with other case studies, a lot of calls, a lot of coaching that was just really helpful to get our arms around the problem and what type of solutions were out there. We were also able to collaborate with the MSU Extension. So what they were able to help us with is engaging with our residents. So Commissioner Nash had started a water affordability stakeholder group so that we could have, some level of accountability for our grant work. And there were a lot of people who participated in that, but we didn't really have that many residents. And we recognized we were holding these meetings during business hours, and that the folks that needed our help, might not have been in the time that we could reach them. So we worked with MSU Extension to find a focus group, and we relied on some of our community partners to find some of our customers who were already receiving energy assistance and some other state assistance programs so that we could get some honest feedback about their water bills, the role of our office, and the type of water assistance and what they were really struggling with. So we were able to have those resident interviews and get a lot of feedback directly from our customers who would be impacted by our policies and whatever affordability plan that we established. Next slide, please. So, with all of the research and the outreach that we did, I mean, there was, we had a better understanding of, what we needed to, what a plan needed to look like for our customers. And so we really wanted to focus on being able to fill the gap between what a household could afford to pay versus what the system actually needed. So we wanted to look at that gap payment and analyze how much money would that be in these communities to fill that gap. And then, how are we going to fund it? So we spent a lot of time, and I mean, a lot of time. Not being an economist, this was sometimes a very challenging, but we had some really smart folks who were working on this. And the most obvious source would be to look at rates. And so that's what we had focused on, right? Could we adjust our rate structures so that we could self-fund? And when I say we, I mean each municipality could self-fund their affordability programs to meet that gap payment. And what we found was that potentially for the city of Pontiac, our larger community, potentially we could do it. We didn't know how, it didn't seem like it would be very sustainable, and it would put a burden on a lot of other households. We knew in the Charter Township of Royal Oak, the very small community, there was no way that they could self-sustain through their rate structure, because if we increased rates on any other customers, it would push more people down into into an unaffordable bill. And so it was, we recognized that we really needed to look outside just the individual communities and really focus on a statewide program. Next slide, please. One of the issues that we had in Oakland County, right, was that, we knew that being able to have a statewide program would provide a sustainable revenue source. But one of the big challenges we faced was that there was a lot of federal funding available for water assistance that was available and wasn't being fully utilized in our community. It was very difficult for us. We knew there was money out there and we knew households needed it. And so that was a big challenge for us, was to try and get and deliver those existing funds to the households that needed it, so that we could build our case for the need for more funding, and not only more funding, but sustainable funding. So we developed a path that was really focused on trying to utilize existing programs, again, so we could put together the data to show some of the need. So there was these are just some of the programs that were again available for us, all building towards showing a need that for a statewide affordability plan. Next slide, please. So our report, it's very lengthy. If you need to something to help you fall asleep, you can go ahead and read this. We also have a policy brief that is much shorter, that can give you a high-level overview of it. And again, this kind of tells you about the grant. It gets into a lot more details of our analysis and the work we did and the programs that we had looked at. And when this water affordability report was published, we had spent some time, going around the state and talking about it. And this, our conclusion essentially was, we want to help be advocates for a statewide program. And so we were fortunate enough to get connected with Senator Chang and start kind of the next leg of that journey. So I'll end it here and pass it on over to Senator Chang.
Great. Well, thank you so much. I love hearing, I mean, we literally have a meeting every other Friday where we talk about water, and we have done that for a a couple of years now, but I never get tired of hearing Sylvia and Sara and Cyndi share all of their expertise. So thanks to the Water Center at Penn for bringing us all together. And it's great to see so many people on. So my name is Stephanie Chang. I serve as state senator here in Michigan. I live in Detroit. My district is a tri-county district. And have been working on water affordability pretty much my entire time in the legislature. And it's truly been a journey. I have learned a ton, and we have made a lot of progress. And I think looking back at the past 10 years, one of the things that I think is definitely true is that there's just been so much more awareness of the issues around water affordability. And there's just been incredible progress in terms of our work together. So I first started running for office in 2014 and was elected to the state house at the time. And that was really the year where there were all of these water shutoffs happening in Detroit. And so it really was through the People's Water Board, hearing about people's stories, people like Nicole Hill, who has publicly shared her story many times about water shutoffs and how she ended up in the ER because of an infection and the shame around, her kids being able to not being able to go to school, but not with being able to actually take care of their hygiene. I mean, just hearing those stories, really, truly heartbreaking. And so that really drove me to want to work on this issue in 2015 when I, started serving in the state house. So we actually held a hearing at the Capitol in 2015 and heard from folks from primarily Detroit and Highland Park about their struggles with water affordability. We also, this was a couple months prior to the Flint water crisis emerging, but also heard from Flint folks talking about their water. And it was something that really generated a lot of interest and led to some bills that actually Sylvia had up on the screen earlier back in 2015, where we had several bills that were a much, much earlier iteration of water affordability legislation. But since that time, we have just learned so much and really crafted a carefully, just a carefully crafted set of policies that will make a huge impact and that are feasible. So 2020, COVID hits. I think that really was a huge turning point for me, at least in my experience, and talking with people about this issue, because prior to people understanding what COVID was, in terms of the details, the initial advice, right, was wash your hands with soap and water. And well, if you didn't have access to water, what were you going to do? And so we quickly saw, the water shutoff moratorium state by state. And unfortunately in Michigan, the executive order that Governor Whitmer had issued was no longer able to be in effect after a certain time due to a court ruling, which I won't get into. But basically, this led to a lot of awareness about water access and affordability during the pandemic. This was mentioned earlier, I think, but the federal money that came down to actually help with water bill arrearages was obviously helpful in so many ways, because it helped a lot of folks to be able to keep their water on. But also, for the first time, we had data that now our state's Department of Health and Human Services was able to collect from those that were willing to share their data with the department, that really laid out, okay, in this tiny township in the Upper Peninsula and in this big city on the west side of the state, in these suburban towns across the state, we actually saw the numbers of how many Michigan households were behind on their water bills. And it was over 317,000 households. And so seeing that was eye-opening for many. I think a lot of us knew that this was a statewide problem, but now we actually had the numbers to be able to show it. And so, that year in 2020, we had Governor Whitmer, Democratic governor, Republican-led legislature, and miraculously, through a lot of hard work of a lot of people, were actually able to pass the water shutoff moratorium, to continue the moratorium that the governor had previously. Through a lot of being able to actually talk with colleagues about look at these numbers in your own district, in rural town, you know, or suburban town or big city. Pretty much we were able to show that this is a problem everywhere. So that was 2020, you know, speeding ahead to 2023. At this point, you know, Detroit's Lifeline program had been created, which is an affordability program for the city of Detroit. We had been seeing the evolution and the success of the Great Lakes Water Authority's Water Residential Assistance Program, otherwise known as the WRAP program. And in 2023, that began a Democratic trifecta in the state of Michigan. And so when I started that term, you know, started having, you know, conversations with a number of folks. We had been working with People's Water Board and NRDC and others for quite some time, but got connected to Sara and Commissioner Nash. You know, had some great conversations with the Great Lakes Water Authority, also some separate conversations with Detroit Water and Sewerage. And I said, let's pull people together, right? This is, I think it was at that point where it really felt like there was so much more awareness about the fact that we are actually all in this together. So being able to actually bring water providers and water advocates together, as well as community action agencies, the Department of Health and Human Services, and other experts to actually get together, learn from one another, look at various proposals from the past, learn what was happening in Oakland County, learn what was working or not working in other programs, and then actually come up with something that can work for everyone. And this process was a really long process, but it was very thorough, and we were able to really through the process of these meetings every other week, and at one point every week, and I think there might have been weeks where we met multiple times a week, where we actually were able to come up with something that had, on the whole, you know, buy-in from, you know, the American Water Works Association, Michigan chapter, water advocates, water providers, and the community action agencies, other human service agencies, and others. And so it was a lot of work, but one of the things that I really loved about this process was being able to actually see water providers learning from the advocates, and the advocates also learning from the providers. And so, you know, there are over 1,300 water providers in the state of Michigan. There are some big ones, but there's also a lot of tiny ones. And so being able to actually hear from AWWA about, well, this is great, but how is this going to actually work for this tiny provider, you know, in Northern Michigan, or, you know, for the providers to be able to hear from Sylvia and others about certain needs of their customers that they may or may not have thought about in terms of really being able to make. I remember a lot of back and forth, for example, about the shutoff protection bill, which I'll talk about a little bit more in detail soon, but a lot of the back and forth about, well, how do we actually make this shutoff notice something that is easy to understand? What are the different ways that we will get a notice to people? Hearing from advocates about, you know, the need for multiple touches, but then also hearing from providers about, well, not every water provider is going to have the person power to actually go knock on people's doors. So finding the right balance between everybody's needs. You can only do that through conversation. You can only do that through a work group process, which is what we did. And so, you know, you've heard about Oakland County's success. You've heard about Detroit Lifeline's program, the Great Lakes Water Authority's WRAP program. And all along, there was just this growing awareness of the fact that we've got these programs, but all of them don't necessarily have a sustainable funding source. And so having their involvement in crafting the solution, as well as the funding source, which is part of the solution, was so critical. So what did the bills do? So a number of things. So the main bill is creating an affordability program within the state's Department of Health and Human Services, in which those households at or below 200% of the federal poverty level would end up with a water bill that is about 3% of their household income, or if they're a lower tier of between 0 and 135% of federal poverty level, 2% of household income. The bill also calls for funding for plumbing repairs, as well as taking care of past due arrearages, $1,500 the first year, $1,500 the next year, and if there's more, you're continuing on depending on what level of extreme need there is. We allow for local providers to create their own program, as long as it meets the standards that are laid out in the bill. There's also a bill that creates a task force within the Department of Health and Human Services that is a comprehensive task force representing all the different interests to help advise the department as the program moves forward. There's also a bill that creates the fund. And so, in Michigan, we have the Michigan Energy Assistance Program, or the MEAP program, where right now, since 2013, every customer actually pays a little bit every month to go into this fund to help low-income energy customers. And so we create a similar funding mechanism of $1.25 per month that is very similar. And again, that MEAP program has been around for quite some time, and actually was passed by a Republican legislature, as we like to remind folks. So that funding mechanism, so critical. And then the third major piece is really around the shutoff protections. I mentioned earlier sort of the learning that everyone did in the negotiating back and forth about what the details should be around the notifications around a potential shutoff. And all of that is to say that really the shutoff notices, the goal is to actually not shut off, right? So the goal is, okay, you get 3 notices so that and then here is how to contact your community action agency to sign up for an affordability program, or here's the different resources. That notification, whether it's a phone call, a mailer, a knock on the door, a door hanger, all of these different options laid out in the bill, 3 notifications at minimum. And then we also put in just an overall ban on shutoffs to critical care customers. So who is a critical care customer? Basically, in short, it's someone with a health-related need where you really need that access to water. We felt that was very important. And there was a lot of conversation, right, about how do we define a critical care customer? How do we protect people from shutoff who really, really need it? But don't make it too big in terms of the category of protections, so that because we needed it to be feasible and workable for everyone. Another major piece of the bill package that I wanted to mention is around tenants. There's this unfortunate situation where sometimes we actually have tenants who are paying their rent to their landlord, the landlord not paying their water bill. And so we recognize that is obviously a big problem. And so we actually have a couple bills related to making sure that the tenant can actually request a copy of the water bill so they can see what is going on with their water bill. And if the tenant has been paying their rent, that they cannot be shut off if the apartment building is sub-metered. So I'm going to put in the chat a link to miwaterplan.com, which is a website where we've put a ton of information. We worked with public sector consultants where they have done an enormous amount of work around analysis around water affordability. And then also, and the need, there's a clickable map where you can actually go and see county by county, just how many people we're talking about. And then also what would $1.25 generate in terms of the revenue and how that would help. And there's a number of op-eds that are on there as well. You can check those out. But one of the things I wanted to just end on is that we have really tried to talk about this issue in 3 ways. 1, talk about it as a public health issue. 2, talk about how this is obviously helping struggling Michiganders who are struggling to make ends meet. But 3, also talk about the sustainability and the fiscal stability of our water providers. And so we talk about all those things. And I think that we have made so much progress in terms of building bipartisan support for this legislation based on a number of changes that we've made, but also the way that we talk about it, the way that we present the data, and the way that we've been able to show how we've brought people together. So thanks, everyone, and I'll hand it over to Cyndi.
Great, thank you so much. And I know we're tight on time to get questions in, so I just, I think a lot of what Senator Chang had talked about were things that I was planning to say, so this is great. I don't need to go back into all of those pieces. However, I want to lift up one thing, which is between the time that the state data was done and we were able to map it by legislative district. And by the way, that 800,000 households, 800,000 people, 317,000 households was only 10% of Michigan's water utilities who were able to access those funds before they ran out. So that was only the bit of need that we were able to identify. But after the moratorium was enacted, through Senator Chang's legislation, the Michigan section of the AWWA really pulled together a team of 36 or so water utilities who were having their own work group to begin tackling this problem and not ignoring it and really leaning in. And it was through the leadership of Jamie Fleming and Boniford Ballard and others that we were able to really start making significant headway. And I just want to give them credit for the work they did. This collaborative, I've been doing this work for almost 40 years through all kinds of water, wastewater, drinking water, stormwater. And this collaborative gives me the most hope, I think, of any of the work that I've done, because there is a sincere commitment to solving the problem and to not ignoring it and to not, hiding from it. So I want to really acknowledge that and then lift up a few other quick things. One is that in addition to the $25 million that was appropriated by the majority Republican legislature in the summer of 2020, after the governor's reconnection order, which was the only, to our knowledge, reconnection order in the country. It was not just a moratorium. They had to reconnect the water and there was money available for plumbing repairs, et cetera. But after that, we have worked together, water utilities, community action, social service, community groups, to secure additional appropriations. And so in FY 2024, we succeeded in getting $60 million for water assistance, not affordability, but it's, again, the short term, we're going to help you out. Last year, we were able to secure 10 million. We are now working to get additional funding. And this is bridge funding, we like to think of it, until we're able to get these affordability bills passed. Second, as noted above, previously, the funding that we got, the data that we got from DHHS was really critical for the first time, understanding the scope of the problem. And we are now working with water utilities to craft a bill that would require water utility data reporting, which is part of this package, so that we can actually keep a very good eye on what is actually happening with water affordability at the utility level. The public sector data was fantastic, and I think we have a link for the public sector consultant specific link on the website. But that was it's really helpful to look at it at a local level as much as we could model that information. But having that utility data is going to be incredibly helpful. And then the final thing I want to mention is we are now collaborating on a sustainable state funding for infrastructure. And specifically what that looks like right now is that there is a there's a road funding debate happening, whether a package is successful in funding Michigan's roads or not. We are arguing that we need to be sure that there's money in there for water, because when they are opening up those streets and they're seeing those water mains that are decaying and not able to come up with the money at the utility level, they're paving back over. So we want a pot of money that is there, that is available. When you find those pipes, you're not covering them back up. You're able to move forward, and that'll take pressure off of rates. So again, I just want to close quickly with the time we have remaining and just say this has been an incredible experience, and I have so much respect and appreciation for all of the panelists and the other individuals and organizations that have been collaborating behind the leadership of Senator Chang in Michigan. So thank you.
Great. Thank you all so much for your comments. I know we are a little bit short on time, but we do have some questions that seem to sort of gravitate around the sort of who falls into the bucket of receiving assistance, and what if you're right above the line, or how do you deal with the discussion from the general public you know, that everybody should sort of pay their fair share. And I'm a little curious if anybody wants to comment on that kind of a framing.
I can start, but others feel free to chime in. Just briefly, so the Lifeline program has tiers. Other programs have tiers, right? So and I think that the 3%, the 2%, those are all things that, right, I think a lot of folks on this webinar are probably aware of, those standards. But I think that we did have a lot of conversation about how to structure this. Should there be 2 tiers or 3 tiers? Talking with the Department of Health and Human Services, they really wanted to have 2 tiers instead of 3 because it's just more manageable in terms of the actual work of identifying who should be in each tier. And then we also, through a lot of conversations that actually Sylvia and others had in Macomb County, which is a neighboring county to Oakland, and elsewhere as well, people who were saying, well, I make above 200% of the federal poverty level, but we're still struggling. So I put this in the chat, but we did actually add a financial hardship piece. So if you are in that just above 200%, but you are, you lost your job or had death in the family, something like that, then you can temporarily be part of that program. So hope that helps.
Yeah, no, I think that really helps. And we did have a question about the current status of the legislation. So if you want to give us a quick update, Senator, on where things stand.
So we're in a new legislative term. So we did just reintroduce the bills a couple weeks ago, and with bipartisan sponsorship in the Senate. And so we forward, and I think that we've made a lot of changes along the way. So we're hopeful that we can figure out a way to gain enough bipartisan support to make it happen.
Great. So I'm just curious if any of you have sort of any reflections on what you think, and Cyndi, you got to this a little bit around the enabling conditions in Michigan that made this effort possible. You've got utility partners, you've got folks working on public health issues and whatnot. We know that Michigan has been the focus of a lot of water conversations over the last several years. So, is Michigan unique or not? Like, can you sort of speak to that for folks who are listening in from other states?
Well, I can take a crack at that. I don't think it should be. I mean, I really think what it required was a sincere commitment to figure out how to solve these problems on the part of all of the stakeholders. And someone like Senator Chang, who was respected in many ways enough to bring people together to address these problems. I think that should not be unique. I think the work that the People's Water Board Coalition has done over the years of elevating the profile of these unaffordable water issues, I fear that in many places, without that activism, without that commitment and organizing, that these problems are not being highlighted. As Sylvia said, they had to go in and really have the conversations because these aren't the kind of concerns that people are going to be shouting, from their homes about, because they're vulnerable and their families are vulnerable. And so I really think it's a combination of all of that. But Michigan definitely should not be unique because we know these problems are happening everywhere, and that we have the people in those places who are able to work together to solve them.
Thanks for that, Cyndi, and the question there, Ellen. I think what's also been really important for us as advocates is really to point out that, look, we've got some serious contradictions here. We've got all this fresh water that's, internationally renowned, and this immense responsibility we have to protecting it. But we've failed low-income households that don't have access to it. And so that was really kind of a baseline too for us to say, look, if we can't do this in Michigan, then how do we expect this to be able to be addressed in other places? So we've really used that is also as a motivation for us to say, look, we have to solve this in Michigan, not only because it's necessary for Michiganders, but for the rest of the country. But we've really had to also push our water providers and even state legislators to see it in the terms that we've tried to define. That, this isn't just about ensuring the water providers have what they need, but especially since these are municipally operated water providing systems, that we've got to ensure that they're, as government, are meeting the needs of local residents. And if a whole sector of the customer base cannot afford to pay, there's got to be a way that they intentionally find ways to make it so that people can pay. The pandemic again showed us all a lot. We saw a lot of vulnerabilities. In fact, we still see it. There are a lot of people that are still fearful for coming forward and saying, look, I don't have water, I haven't been able to pay, or I'm using water that's unauthorized. Some will say they're stealing it, but we say unauthorized. And so we've got to figure out how to do this for the benefit of the whole.
Great, thank you. Well, I do want to note that we are at 3 p.m. I know we've had some other questions. We'll try to answer some of those either through, the things that we share back with you after this webinar, because we will be sharing the recording and other information. But I really appreciate everybody's time. This is an incredibly important topic, not only in Michigan, but as Sylvia said, across the country. We hear it from all of the water systems that we work with in the Mid-Atlantic, that, this water affordability challenge is big and we need to be addressing it. And the more I think we can do right now at the state level, the better. So I really want to thank you guys for the great example that you've set for us. And we look forward to working with all of you on board with, in other states to try to move this conversation forward to the benefit of, all of the people across that are served by our water systems, and to the benefit of our water system managers too. They want to address this issue too. So thank you all very much. We appreciate your time today and look forward to moving forward on this issue.